Hi, my name is Jennifer Dutenheffer. I'm a 4th semester nursing student. Today is September 21st. It is approximately 12:45, and today I'm going to be demonstrating insertion of an NG tube and administrating medications through an NG tube and removing the NG tube. So the first thing I would do is I would assess my patient. I would assess for any past history of surgeries, any deviated septums, gag reflex. I would also assess as to why the patient is getting the NG tube and the size of the tube that is going to be needed. I would gather all of my supplies, and I would then go to the patient's room, introduce myself, and identify the patient with 2 patient identifiers. I would provide privacy. I would do hand hygiene, and I would explain to the patient what we will be doing and why it is necessary, and how the patient can cooperate during the procedure. So the next thing I will do is I'm going to go ahead and lay a towel on the patient's chest. This way it'll keep the patient clean. I'm going to assist the patient up in high Fowler's position. And then I am going to go ahead and don some clean gloves. I would also have a pen light, and I would use the pen light to check the nares and the patency and just kind of decide which nair would be the best one to use for the NG tube. And then after that, I would take the NG tube and I would go ahead and measure from the tip of the nose to the earlobe, and then from the earlobe down to the xiphoid process. I would go ahead and take that measurement and mark it with tape, so I know how far we're going to insert the NG tube. Okay, and then once that is finished, I'm going to go ahead and lubricate the end of the NG tube at least 4 inches with lubrication. The next thing I'll do is I'm going to have the patient hyperextend his neck, and I'll have a pillow behind him to keep him comfortable. I'm going to go ahead and hyperextend his neck, and we're going to insert the tube, and by doing so we're going to go along the bottom of the nasal cavity past like the floor area, and then we're going to kind of direct it towards more of that same ear on the side that the nostril, on the side of the nostril we're using. So I'll go ahead and have the patient hyperextend his neck. For video purposes, we have to do it for the mannequin. And then going down towards the ear. Once I reach the oropharynx, I would go ahead and have the patient tilt his head forward. I would not let go of the tube, but I would get a cup with a straw and have the patient sip on some water and swallow. And as he's doing that, I would advance the tube 2 to 4 inches each time until we finally reached the measurement that we need it to be at. So when we reach that measurement where the tape is at, I'll go ahead and temporarily secure the tube in place. Once it's temporarily secured, we're going to check placement. So there are a few different ways you can do this. One of the ways is you can pull up 30 mils of air in a syringe, and then using your stethoscope, you can listen on the abdomen while you inject the 30 mils of air, listening for a swishing sound. Another way you can do it is by pulling up some gastric acid and then using the pH paper and putting the acid or the contents on the pH paper, making sure it is the same pH level as what the stomach is. And then the definite way you can tell that you're in the correct place is by x-ray. So for this, we are in the right place, so we're going to go ahead and secure the tube more by placing some more tape on it. I'm going to take a piece of tape and kind of tear it in half, but not all the way, and make it look like a pair of pants. And put that on the bridge of the nose. And then we're just going to wrap that around. Under one, and then under the other one, and then make sure it's nice and properly secured. We'll also put a tape on the lower down the tube, enough to where it provides enough slack for the patient, and then this way we can tag it, and then we can safety pin it to the gown. So that way the tube is also nice and securely placed, leaving enough slack so in case the patient does turn his head, it's not going to come out on accident. Once we have properly secured all of that, I would hook up the tube to suction per doctor's orders, or clamp it off if that's what was needed to do right now. I would document all relevant data, such as the nostril that was used, how far the tube was advanced, and if there was any secretions while inserting it. I would go ahead and take my gloves off, wash my hands, and now we're going to go on to administering the medication. So for video purposes, I've already crushed up my pills and taken the crushed pills and put them in 20 mils of sterile water and switched it around and let them sit there. So now what I'm going to do is I'm going to assess my patient. I'm going to assess if he's on any continuous tube feedings because we want to discontinue those for the time being. And then I would also assess to see if he has any nausea or vomiting before administering medications. I would gather all of my supplies. I would grab the medications that are ordered for this time, and I would make sure that they are crushable before crushing them, and complete the 2 medication checks before entering my patient's room. Once getting into my patient's room, I would introduce myself. I would identify the patient with 2 patient identifiers. I would explain what medications he's getting, why he's getting these medications, and let them know how they're going to be administered through the NG tube. So then I would wash my hands. I would provide privacy for the patient and make sure that he is in the high phallus position before administering the medication. Next, I'm going to go ahead and put some clean gloves on. And the first thing I'm going to do is I'm going to check placement of my tube. So like I said earlier in the video, one of the ways you can do that is by instilling 30 mils of air into the NG tube, listening for the swish sound in the belly. So yes, we are in the correct place. So now what I'm going to do is I'm going to hold the tube and I'm going to go ahead and clamp it off. And we're going to flush. Well, first we're going to get our piston syringe and we're going to attach it on the end. And then we're going to flush with 20 to 30 mils of sterile water. We're going to unclamp and let that go on through. Okay, we're going to go ahead and clamp that up again. And we're going to give our first medication. The first medication has been crushed up and has been dissolving in 20 mils of sterile water. We're going to go ahead and let that go on through. Before I would have done any of this, after checking placement of the tube, I would have pulled back some residual volume if the patient had been on tube feeding, or even if they haven't, I would still pull back residual volume, and depending on how much volume is left, would, per doctor's orders of what to do with the medications. But in this case, for the video, the residual volume was fine, so you would just push that back in and carry on with the flush and medication. So now that that medication is in, we're going to go ahead and flush again with just sterile water. And let that go on through. Okay, that flush has gone through, so now we're going to go ahead and instill the second medication. we're going to clamp off again, and we're going to flush with 20 mils of water. And then we're going to unclamp and let that go on through. Okay, we're going to go ahead and clamp it off again. Take our piston syringe off and go ahead and just clamp the NG tube for now, because we don't want to hook it up to suction for at least another 30 minutes after instilling the medication. Once I am finished with that, I'm going to go ahead and take off my gloves, wash my hands, make sure the patient is doing okay after administering the medication, and then document what we administered, the time, how much, and all that stuff. So the last part of the video, we're going to demonstrate removing the NG tube. So the first thing I would do is I would assess my patient by assessing all 4 quadrants of his abdomen, listening for his bowel sounds, making sure they are normal. If he is on continuous tube feeding, that I would stop that and wait 30 minutes before removing the NG tube. So all of that has been done. And so I'm going to go ahead and identify myself and identify the patient with 2 patient identifiers, provide privacy, hand wash, get the patient in a sitting position, and let him know what we'll be doing, that we're going to be removing the NG tube, and how he can help and cooperate with this. So I will, like I said, wash my hands, put clean gloves on. I would take the suction off of, or I would take the tube off of the suction, and we're going to go ahead and put the piston syringe on, and we're going to flush like 10 mils of sterile water into the tube. Once that's gone through, I'm going to go ahead and remove that syringe. I'm going to take the safety pin off the gown, and I'm going to take the tape off the patient's nose so we can remove it. I'm going to pinch the tubing and have the patient take a deep breath, and then slowly, gradually, gently pull out the tube. Okay, and then we're going to check the intactness of the tube, make sure everything's intact, nothing was left behind, and then we will dispose of all of that stuff. So once the tube is out, I would check to make sure my patient is doing okay. I would give him a Kleenex if he needed to blow his nose or anything like that. I would document any relevant data, such as any type of secretions, what is in the suction container, if it was hooked up to suction, and all of that. So that concludes my video. Thank you.